Okay, today's topic is about the acute diarrhea. I will be making two videos. In this video, I'll cover the etiology and pathogenesis. In the next video, I'll cover about the assessment of child with acute diarrhea and the management. Okay, now coming to this video, what is acute diarrhea means? There is a change in consistency of the stools from liquid to watery, or both are same actually, liquid and watery stools, and the frequency may be increased like greater than 3 times a day, and because of these conditions the child goes into the malnutrition and dehydration. Okay, whenever these consistency and frequency of the stools satisfy the condition and which are present less than 2 weeks, it is called as acute. Whenever these conditions are present greater than 2 weeks, it is called as persistent diarrhea. Okay, coming to etiology, there are many etiological factors. First, it is intestinal infections like bacterial or the E. coli, Klebsiella, Shigella, which mainly causes the dysentery, and Salmonella, which causes typhoid, and Vibrio cholera, rice water stools. And other viral infections are rotavirus, picorna, adenocorona, inocorona. Recently, it causes diarrheal symptoms also. Next, Giardia, Entamoeba histolytica, Cryptosporidium. These are the parasites. Okay, next, some of the drugs which we take, like antibiotics, broad spectrum antibiotics, which kill all the good bacteria that is present in the intestine. What happens is whenever these good bacteria die, there is more chance of pathogenic bacteria to grow, like Clostridium difficile. What happens is this requires space and nutrition to grow the pathogenic bacteria. Whenever the good bacteria are killed by the antibiotics, it has more free space and also more nutrition available, and also no toxins which are released by good bacteria to kill these bacteria. So all inhibitory factors are lost, so these will overgrow and it forms diarrhea. And also Clostridium difficile will form pseudomembranous colitis. Okay, next factors are poor sanitization and poor hygiene, and no safe water and food for drinking, and no immunization taken, and decreased breastfeeding during the childhood, and there is malnutrition. And whenever we take that what is that, proton pump inhibitors, what happens is the hydrogen HCl production decreases, and it favors the passage of the pathogenic bacteria through the gut. So hypo and echlorohydria are also main factors, and immunodeficiency states and antibiotics which we take will cause acute diarrhea. This is about the etiology. Next, coming to pathogenesis. Pathogenesis is mainly in our body we contain two fluid compartments, that is extracellular fluid compartment and intracellular fluid compartment, which is present inside the cell. Intracellular means, extracellular means there is circulating blood, intestinal fluid, and other secretions. So remember one thing, that in a cell always potassium levels are high and sodium levels are high outside the cell. So what happens is in extracellular fluid there is more sodium and less potassium, obviously. So whenever diarrheal losses are mainly extracellular losses. So extracellular losses means there is more loss of sodium, and there is loss of potassium also, but there is more loss of sodium. Okay, loss of both actually, but sodium losses are more. So what happens is there is loss of water in extracellular. Okay, there is reduction of extracellular fluid compartment, and there is hyponatremia, means sodium levels are falling. Okay, so it causes decrease in ESF osmolarity. So what happens is extracellular fluid volume has mainly sodium, more sodium I have said. So whenever the sodium is lost, what happens is there is osmolarity decreases. So whenever osmolarity decreases, what happens is the fluid which is present here is hypoosmolar. So it will go into the cells, extra water will go into the cells. So again it will cause decrease in the decrease in the fluid compartment, extracellular fluid compartment. You understood? I will show here. So there is loss of water in the extracellular fluid compartment, so it causes hyponatremia. So it causes extracellular fluid osmolarity falls. So water moves from ECF to ICF compartment. So there is further shrinkage of the extracellular fluid volume in hyponatremic dehydration. There is also hypernatremic dehydration, which is actually reverse of this thing. There is hypernatremia developing, and also the fluid. So whenever there is hypernatremia, what happens is the fluid which is present here will come out into the extracellular fluid volume in hypernatremic diarrhea. Okay, in 5% people it will occur, but this is the most common hyponatremic. Okay, next, continuation of pathogenesis. These are clinical features. So what happens is the skin turgor decreases because mainly due to fat and extracellular fluid only. Whenever we pinch the skin, it will come back normally. So on pinching, it will take few more seconds to recover. So the skin is called as soggy, doggy, or leathery appearance. And whenever the extracellular fluid volume is falling, there is decrease in the blood volume. So what happens is there is weak thready pulse in them, and the blood pressure is low, and cold extremities are present. Okay, so as extracellular fluid volume falls, the same I am telling, blood volume will fall. So whenever blood volume will fall, the blood vessel connecting the kidneys supply less blood to the kidney, so there is less filtration, so low urine formation. So it forms oliguria, and finally when it is severe, anuria. So whenever hydrostatic pressure falls, there is less filtration by the kidney, and there is decreased urine output. So in severe cases, there is renal failure. Okay, next is what happens in diarrheal stools. There is more sodium and potassium loss. Potassium loss is also there. So there is hypokalemia, means in the plasma there is hypokalemia. So features of hypokalemia are abdominal distension, paralytic ileus, and muscle hypotonia. These three features you should remember: abdominal distension, paralytic ileus, and muscle hypotonia. So what happens is these conditions can be seen whenever there is increased loss of potassium. Okay, in ECG, what we'll find is there is ST depression and flat T wave in hypokalemia, and there are also arrhythmias associated with hypokalemia. Okay, and due to more loss, that is normally intestinal secretions are alkaline, so more loss in alkalinity causes the there is loss of bicarbonate ions, so it is causing metabolic acidosis. Okay, in metabolic acidosis, we know the features. It is Kussmaul's breathing, that is a deep and rapid breathing. It is also present in the metabolic acidosis due to intestinal alkaline losses. Next, other symptoms we can summarize, symptoms and signs. These are in mild diarrhea or dehydration, the patient child feels thirsty and slightly they are irritable. In moderate, there is increased irritability, and if it is infant, then the fontanellas are depressed. There is sunken eyes and cheeks. Inside the cheeks, the mucosa is dry, and also the tongue is dry. And whenever hypokalemia is present, there is abdominal distension, and also the three features: paralytic ileus and muscle hypotonia. And whenever there is increased severe dehydration, there is acidosis, and there is Kussmaul breathing and decreased urine output. You should remember these things for pathogenesis. Next, we'll learn about the assessment of the child with acute diarrhea, and laboratory investigations, principles, and management. Okay, management is so much.